Well, good afternoon, everyone, and welcome to our fourth in a series of virtual roundtable discussions on responding to the COVID-19 crisis. We're very excited about today's roundtable, which will focus on how this pandemic is affecting retirement security for three distinct cohorts of our population: boomers, who are either already retired or had planned to do so soon, Generation X, mostly in mid-career, and millennials in both mid and early career. Our speakers will explore the issue with respect to all three elements of retirement income: Social Security, private retirement accounts like 401k plans, and defined benefit pensions, both public and private. This will provide a broad perspective on how this catastrophe is reducing security in so many ways, but also will focus on the range of policy options available to counter them. We're very encouraged by the enthusiasm we've received so far from you, our members and supporters. You represent expertise in all areas of social insurance, and you value this platform for conversations about the importance of our social insurance infrastructure during this crisis. You and the participants in our prior three roundtables have clearly conveyed the need to reinforce now more than ever the vital role of social insurance in providing economic and health security to all of us. Indeed, today's discussion illustrates how much worse, just imagine how much worse retirement security would be in the absence of support from Social Security, a core social insurance program, and other complementary vehicles for retirement savings. Today's discussion will also help shine a much needed spotlight, as we've said before in these roundtables, on some critical gaps in social insurance. And in the weeks and months to come, we really want to continue to highlight not only all that social insurance programs currently do, and we never want to minimize what they do, but also candidly what they could do to further address the economic and health issues that our country is facing so dramatically today. We want your expertise, we want your insights to enable us to do that work. Please keep your thoughts and suggestions coming, and of course, your questions. Now, on that note, please look for an announcement from us the next few days of an exciting kickoff event for the work that's going to be taking place here at the Academy in late June. We'll be announcing it in more detail on our website. Our goal is to bring together multiple social insurance projects in a new campaign and engage all of you in various ways. So please stay tuned for more information on that. Now, we have 60 minutes today, a lot to cover. For those of you who are Zoom veterans, you know how to use the two devices I'm going to review quickly, but there's two ways to participate. There's the chat box and the Q&A box. The Q&A box is really where you want to pose specific questions for our speakers or for other participants to consider. And you'll see both boxes on the menu at the bottom of your screen. The chat feature is where you can have a conversation among all audience members. To do that, make sure you mark as recipients all panelists and attendees. The default option is just all panelists, so you'll have to switch to all panelists and attendees manually, and this will ensure that everyone will be able to see your comments. When the webinar ends, we hope to continue this discussion on our website. We'll advance the discussion with our new Academy COVID-19 website section, which grows weekly. It also will include links to relevant information material from organizations represented on our virtual roundtables. Please share your work with us, or any work that comes to your attention that you think really provides significant insights into the dimensions of this crisis on social insurance. We value that input. Let me introduce Cristina Martin-Firvida. Cristina is the Vice President for Financial Security and Consumer Affairs at AARP. Our Academy has been thrilled with the collaboration with AARP in many ways, and Cristina moderating today is just another example of that close consideration. Cristina will introduce the other panelists. So Cristina, let me turn it over to you.
Thank you so much, and thank you for putting together this terrific panel. As we all know, COVID has dramatically transformed the lives of so many people around the world, and in particular older people who are at high risk of dying from the disease. And we see that especially here in the US, hitting particularly hard older Americans and communities of color. In addition to changing all the lives of people who can be sick from COVID, it has just changed generally what it means to be in a job, what it means to be parenting, what it means to be a student, and of course also what it means to be retired. A lot of problems that existed in our retirement system that were always there have really become a lot clearer now, just as a lot of health and wealth disparities that existed across age cohorts and in particular demographies were always there and also have now become in sharper relief. So they've been pushed out in the open, and it's making us all think harder about all of these questions that we've all been working on for years, if not decades. So the question that we really want to talk about today is how many of the transformations that COVID has made in the retirement landscape, how many of them will be permanent? And how many of these pre-existing conditions, the disparities that have always been there, how many of them will be deepened, and are there any that might be alleviated? And just in general, what does it even mean to be retired, or where will we get any income, retirement income included, in the near future and in the far future as well? So with that, I'd like to introduce today's panel. Shai Akabas is the Director of Economic Policy at the Bipartisan Policy Center. He will be focusing on the pandemic's implications for Social Security. Shai conducts research, as you all know, on various economic policy issues, including the federal budget and retirement security, and for the past few years has steered the Bipartisan Policy Center's Commission on Retirement Security and Personal Savings. We also have Abigail Zapote, who will speak about the crisis impacts on 401ks and other private retirement savings vehicles. In her capacity as the Executive Director of Latinos for a Secure Retirement, Abigail leads a coalition of Latinx organizations to protect Social Security, strengthen Medicare, and increase pension access and financial literacy for Latinos of all ages. And finally, we have Tyler Bond, who is the Research Manager for the National Institute on Retirement Security. His presentation today on pensions is informed by both his research at NERS on numerous issues related to retirement security, as well as his prior work at the National Public Pension Coalition, where he directed the research program. So let's get right to it, and let's start with Shai. Your research on retirement security is, of course, well known and highly respected. We want to talk to you about Social Security, which is, as everyone agrees here, the foundation of retirement income in America. Social Security was enacted during the Depression, tail end of the Depression, in response to the deep economic crisis the Depression presented to millions of Americans, and is helping millions of Americans right now to make ends meet during this difficult crisis today. At the same time, the crisis is having its own impact on Social Security. And you've done some really interesting work recently. Can you walk us through your recently published estimates on the impact that COVID will be having on the immediate future for Social Security, in particular its finances, and what it will mean for the trust fund in particular?
Sure. Well, thank you, Cristina, for that kind of introduction. And is my audio all right?
You sound great.
Okay. And I apologize, you mentioned parenting up front. I do have a couple young kids in the other room, so if you hear the occasional squeal, that's what that is. And thank you to the Academy for hosting us here for the discussion today. Going to walk through quickly what my colleague Nico Gladstone and I put out a few weeks ago in terms of the possible implications from the coronavirus fallout, the economic fallout on the Social Security trust funds. If you could move the slide deck forward, actually several slides. I'm going to skip through the first couple points and maybe come back to those in the Q&A. About 6 or 7 slides in, going to that third bullet point. So we attempted to look at a little bit further. I think it's another 3 or 4 slides. Apologies. We attempted to look at so right here. This is perfect. Sorry. We attempted to look at the impact that another Great Recession could have on the Social Security trust funds. And what I mean by another Great Recession is if we saw economic effects for the next decade that look like the effects that we saw in the aftermath of the 2008 financial crisis. That entails all of the effects after that. Certainly things will not look identical to that period. We know that there will be differences. We don't know what those differences will be. It could also happen that the current downturn is much briefer and doesn't have those same long-term deleterious effects that we saw from the Great Recession, or it could be an even more severe downturn than we saw at that point. So there's an enormous amount of variation in these estimates. We've provided a few scenarios in the blog that we put out a few weeks ago. We're actually putting together an issue brief that looks at the issue a little bit more comprehensively now. But for the moment, let me focus on the scenario that is the Great Recession. So what we've seen so far is actually a drop in revenues in the first year that we expect will likely exceed the severity of the Great Recession. And there's been a lot of discussion about how quickly employment has dropped off the cliff. So many people are now not earning their incomes and thus not paying taxes into the Social Security trust funds. As many of you probably know, the Social Security trust funds are funded mainly out of payroll taxes and self-employment taxes, taxes on Social Security benefits, and interest on the trust fund. All three of those revenue sources are likely to be depressed as a result of this downturn. The most obvious, of course, is payroll taxes. If people aren't working or their incomes are lower or they work fewer hours for the year, they're going to be paying less into the trust funds. The taxation on Social Security benefits, if people have less income, those benefits are taxed when income exceeds certain thresholds. If people are getting less out of their retirement accounts, less income in general, then there will be fewer dollars to be taxed and collected as part of the revenue that flows into the Social Security trust funds. And then finally, if interest rates are lower for a prolonged period of time, as they seem likely to be because of the moves that the Fed has made and just the economic effects from the coronavirus fallout, then we would expect that the interest that the Social Security trust funds earn on their reserves will also be lower. So all three of those revenue sources are taking a hit. Now, when we look at the benefit side, there's a couple impacts. The first is that we are likely to see an increase in the near term in the claiming of Social Security benefits. Many people are losing their jobs, especially older Americans. We've seen to date, I think it was as of April, about 22% of those over the age of 60 have been estimated to have lost their jobs. Some of those jobs will come back. Many of them will not, unfortunately, and more could be lost in the coming months. If people are without a source of income, unemployment insurance could help many of those people for a period of time. We don't know how long those benefits will be extended. But at some point, many of those people will likely have to resort to claiming Social Security early. And that's what we saw in the Great Recession. We expect that uptick will increase Social Security costs in the near term. The other factor on the cost side actually works in the opposite direction. And you might think that it would be pretty significant. Tragically, we are losing tens of thousands of people to the coronavirus, and we expect that that will likely continue with a pace undetermined for at least the coming months, if not a longer period of time. We obviously hope that that will be shorter, but we know that it is meaning that many thousands of people who would otherwise have collected Social Security benefits for a longer period of time are not collecting them because they are now deceased. Surprisingly, that has a very small impact relative to these other pieces. Actually, if you skip ahead to the next slide, if we show the impact on the trust fund from these three pieces that I've talked about, all of these revenue changes, mainly the payroll tax drop that we would expect to see if we had another Great Recession, and then the additional claiming costs and the increased mortality, you could see the increased mortality is negligible there. And that's because even though it is a remarkably large and tragically large number of people who are passing away, first of all, not all of them are Social Security beneficiaries, but second of all, as a percentage of the population that receives Social Security benefits, it is actually quite small. And so on the cost side, it is actually not that much cost savings from these people not collecting those benefits. The end result here is when you add all of this together, and the prior slide, I apologize for these being out of order, has the graph that shows this result, is that the trust fund we expect that would have been depleted in 2034, the OASI Old Age and Survivors Insurance Trust Fund, could now be depleted as soon as 2029, so 5 years earlier. This isn't shocking when you think about it on an order of magnitude scale. If we look at what happened with the Great Recession, the trustees before the recession were projecting that the trust fund would be exhausted in 2041, and then that moved up to 2033 at one point, several years into the recession because of the effects that economic shock had had. Now, again, there is an incredible amount of uncertainty here. Steve Goss, the chief actuary of Social Security, has run sort of back of the envelope a few scenarios of his own and has showed that if we just see a 1 or 2 year effect on the economy from this situation, then we could see a much smaller change in the insolvency date of Social Security, something like 2033 or 2032. That is certainly within the realm of possibility. Looking at this as sort of an economic analyst, I foresee a pretty long economic downturn. I don't think that we're going to have a V-shaped recovery. I don't think that payrolls will be back next year to anything like the levels that they were projected to be. So I would guess that the estimate of somewhere in 2029, 2030, 2031, it could be a range of those years, but it will be sometime significantly sooner than we expected. Again, things could change between now and then. The economy could take off in the 2020s and we could see some reverse effects. But this is what we're seeing right now in terms of the impacts from the coronavirus that are likely to have if we saw a scenario that was along the lines of the last Great Recession.
Shai, I wanted to ask you a follow-up question. Of course, one of the big differences between now and 2008, 2009, you're exactly right to point out this can't feel like a huge surprise in terms of order of magnitude. It seems about right. Big difference was then when we saw that shift forward in that date was still, it felt manageably far away. I'll use that term advisedly. What you're estimating now is telling us really that we have a big change potentially in front of us within a decade, which is, I think, a different kind of a question for different folks on this roundtable or on this call. For some of us who are advocates, that poses one set of challenges. For others who are in direct services, for example, that presents a whole other set of things to plan for. And on that point, actually, the follow-up that I particularly wanted to ask was, do you have any estimates now, or are you working on any of what would be the percentage of promised benefits that could be paid based on existing income streams to Social Security if we did see this date move forward, as you were suggesting, to 2029?
Yes, that's a really good question, Cristina. And we actually don't expect that to change all that much. And the reason for that, so we project that it would be able to pay 76% of benefits in 2029 if this scenario were to take place. The reason for the fact that I can't remember what the exact number is in the latest trustees report. I think it's something like somewhere between 76 and 78.
I think it's 79 for the 79. Most recent report. Yeah.
Okay, thank you. So we expect it to not be all that much different because the revenue loss we expect to largely be in the next several years. Once things recover, then it returns to something more like a steady state. And so the actual scenario when the trust fund runs out is not all that different as it would have been under a baseline scenario without an economic downturn like this. I think that's still pretty concerning because it actually points to the bigger problem than the exact insolvency date, which is that we have about a 1/4 difference between the revenues
Absolutely.
that will be coming into the program and the costs that need to go out from the program. But again, not too much of a difference from what the trustees are projecting right now.
Well, thank you. And we'd like to maybe now move on to Tyler, if we can do that. Again, Tyler has done so much work on pensions, defined benefit pensions. And as we know, those are hard to come by these days. So, other forms of wealth and assets have had to replace the role that traditional defined benefit pensions have played. We all know this. However, Tyler, thanks for joining us today. As you point out, you're about to in your presentation, assets and wealth that can be tapped for retirement income are very unevenly distributed, and disparities by age cohort are well known. Those are not new, but a lot of those disparities may be significantly exacerbated in this present moment because of COVID. And it will be great to hear from you a little bit more, to give us some context about that, give us some also outlook on what different age cohorts might expect moving into the future, whether or not they can reasonably recover from the setbacks that COVID and prior recessions have presented to them.
Thanks, Cristina, and thanks to the Academy for having us today. So on this first slide here, this is Department of Labor data, and it shows how much the retirement landscape has shifted in the past 30 years, as you see defined benefit plans declining significantly and defined contribution plans increasing significantly. So we've seen this very dramatic shift since the late 1980s in the increase of private sector workers being offered defined contribution plans rather than defined benefit plans through their employer. And so on the next slide, this data is actually from a report that NERS released earlier this year called Examining the Nest Egg, where we looked at the different sources of retirement income. So we were only looking at Social Security income, defined benefit income, and defined contribution income for older Americans who are working less than 30 hours a week. So basically folks who are not working full time anymore. And I'd start off by pointing you out to the column on the right, which shows the net worth of these households, excluding their retirement assets. And you see that the folks who are receiving income from defined benefit pensions and Social Security, the median net worth is just over $100,000. When you then move to the folks with defined contribution income and Social Security income, or the folks who have all three, that nearly triples to over $300,000 in median net worth. And if you then go to the second column, the median Social Security amount, so this is the median amount of Social Security income that these different households are receiving, and you see that the amount continues to go up. And I think what this is telling us is that the households that are receiving a significant amount of or all of their retirement income from defined contribution plans look different than the households that were receiving income from defined benefit plans, who seem to be much more middle class and middle income than the households receiving income from defined contribution plans. So let's skip ahead a few slides. So this will come in the context of another report that we released last year, which was an issue brief looking at financial asset inequality. Go on to the next one, please. And the next one. So we looked at the distribution of financial assets among three generational cohorts, Millennials, Generation X, and Baby Boomers. And we actually looked at Baby Boomers at 3 points in time, in 2004, in 2010, and again in 2016. And all of this data is based off of the Survey of Consumer Finances. And what we found is that in 2016, the top 50% of baby boomer households by net worth owned 98% of that generation's financial assets, and that the top 25% of baby boomers owned 91% of the assets, the top 10% owned 75%, and the top 5% owned 60% of the financial assets. And I think this is concerning because, as we saw in the first slide, there's been this significant shift from defined benefit plans to defined contribution plans. And if we're now relying on workers to save on their own in defined contribution plans, either in 401ks offered by their employer or in IRAs, and invest those savings in these financial assets, the ownership of these assets is very highly unevenly distributed, and that has worrying implications for retirement security. And on the next slide, we see for millennials, they've nearly reached the same levels of inequality in asset ownership, but much earlier in their life cycle. And we know that wealth inequality tends to compound over time. And so the fact that millennials in 2016 were already hitting these levels of inequality seems to be concerning for the future. So putting this in the context of the crisis today, I think the two thoughts that come to mind, first of all, for me, are for the baby boomers who have not yet retired. I think they're in perhaps the most difficult situation right now, because if they do have savings in a defined contribution plan, they've likely lost a portion, perhaps a significant portion of the assets that they were planning to retire on. And, they may end up claiming Social Security early, which will then lead to a lifetime of lower Social Security benefits. So I think that's concerning. For millennials, once again, millennials are facing another economic crisis that's going to be disruptive to their lives. Many millennials graduated either just before or during the 2008-2009 financial crisis. Many millennials today may be approaching the midpoint of their career, but if they're a worker who just lost their job because of the pandemic, this could be yet another setback for that generation. Seeing that millennials have trailed previous generations in a number of measures, from delaying marriage to delaying having children to delaying home ownership. And I think for every setback that millennials experience, it's going to make it that much more difficult for them to ever get caught up to perhaps where previous generations were at the same point in their life. And when millennials do start to approach retirement age, they seem like they'll likely be farther behind than where boomers or previous generations were.
Do you see, Tyler, any sources of retirement income? Is there any class of assets that, and I'm not asking you for financial advice, I'm asking you a broader question. Is there any class of assets that this situation we're in right now makes it more, is there anything that someone can rely on more if they're a millennial or even Gen Z? I think you're pointing out that many millennials are graduating from college during the Great Recession. I think Gen Z, everyone I think feels badly for the college graduating class of 2020. Right. The Gen Z looks like they're setting up to be in an even tighter spot than millennials. Is there anything in your research that shows any glimmer of hope? And so maybe the example I want to offer is I know that when we talk to, we're AARP, we talk to older individuals, but when we talk to millennials about what they draw on for income and what they think they will draw on for income when they're older, they often do talk about how entrepreneurial they are, about how they're able to adapt to different work environments and demands, either as gig workers or in other ways. I'm just curious if there's any research that you've done that suggests there's anything in this moment when so many things are being transformed, including jobs, that might have a silver lining for millennials or Gen Z.
So two thoughts come to mind. The first would be the establishment of the state-facilitated retirement savings plans, the Illinois Secure Choice Plan, Cal Savers, Oregon Saves. We've seen, I think now it's 10 to 12 states have established some form of state-facilitated retirement savings plans, and those are geared for workers who are not offered a savings plan through their employer. And I think as we see more workers shift to the gig economy or other non-traditional work arrangements where they're not being offered a retirement savings plan through their employer, these types of programs are going to become increasingly important to facilitate savings among working people. And the other thing I would say is look at public pensions. We talked at the very beginning about this big shift in the private sector away from defined benefit plans to defined contribution plans. But in the public sector, the overwhelming majority, it's around 90% of state and local government employees are still offered a defined benefit pension. And I think one thing that'll be interesting coming out of this crisis is we've seen a lot of public employees really being on the front lines of this, whether they're doctors and nurses at public hospitals, firefighters, other public employees have really been on the front lines of a lot of the issues that we've been dealing with for the past couple of months. And it would be interesting to see over time if that sparks a renewed interest among millennials and Gen Z into going into public service, which would have the ancillary benefit of giving them access to a defined benefit pension, which would set them up to have a more secure retirement.
That's definitely food for thought. I mean, there are so many things that are so dramatically changing right now that it is important to challenge ourselves to think about what do we want to put on the table in terms of solutions or possible paths forward. I want to maybe shift now to Abigail Zapote, as the Executive Director for Latinos for Secure Retirement, has done so much important work to address retirement income disparities in the Latinx community. And we're really happy to have you today because disparities in health and wealth, which have always been especially pronounced across race and ethnicity, thrown a very bright spotlight on them. And it would be great to hear from you about how the highly volatile markets for both investments, for some of the investments that Tyler just covered that we all now have to engage in a defined contribution environment, but also the highly volatile labor markets, how those will both impact different groups and how the long-term prospects of having a secure retirement have changed for all of these groups, because we're not all being affected in the same way by the same crisis. So, Abby, if you could give us some of that context, that would be terrific.
Of course, thank you. Thank you so much. And part of this conversation that we're having today, specifically to communities of color, really, I just want to say that we need to start understanding how to better advocate for these communities as well, beyond just talking about retirement, right? Part of the discussion that you mentioned is just how the labor markets and how volatile they are specifically to this community, right? We know that Latinos and communities of color have a history of health disparities, lack of health insurance, high representation in low-wage jobs that don't offer pension plans, retirement plans, and let alone right now, they work in places that aren't offering proper PPE or human protections specifically for undocumented communities. So I think that's also part of the larger conversation when we're talking about how folks can even be able to save for retirement, because for some of these folks, they're not even having the access to particular income that would allow them to even save. But within this first slide that we have up, the volatile stock market has, we have clearly seen the change from the last quarter in 2019 to the first quarter in 2020. I mean, there was that huge loss of 19% for 401ks and 14% for IRAs. Like Tyler mentioned, this is going to affect those that are in retirement right now or that are nearing retirement because they've spent their whole lives saving up. And, from one day to the next, sure, 2 months, 3 months, after, or in 3 months, they lost a significant amount of money, specifically those who had a lot of money in there. I mean, that percentage obviously represent a whole about 1/5 of someone's savings, right? Their entire life savings. That's a lot. And then I think, even as we're talking about the volatile market, we should also start talking about how, financial security will actually play into accessing some of the money that is actually in those retirement savings accounts. So we know that a lot of people have lost their jobs. Currently, I think it's about 27 million people that have lost their jobs. So not only are they losing their income, they're also losing their health insurance, and they're also losing access to those retirement accounts. I mean, they'll still have them, but they will no longer be having their employer also putting money into them. And more than likely, if they lost their job, they're not going to be putting money into that account either, right? So number one is stopping those contributions to your savings accounts. 2, the risk tolerance, depending on age, right? Just as I was talking about, folks that are older are probably, wanting to keep all of that money there, and they really don't have that time access to see that that money grow the way that younger generations might be able to see. Also, there are those people that are still making a significant amount of money. Maybe their income hasn't changed. Maybe they still kept their jobs. And so there are some folks that are going to be taking advantage of those market dips, especially if they do have that longevity to be able to take on that risk. But I think also, as folks, even for those folks that do keep their jobs, a lot of businesses are struggling. One of the first things that they'll do is they'll cut back on 401k matches. And so that's also going to prevent folks from increasing those savings during this difficult time. And then also with the legislation that just passed, or the first CARES Act package that allowed folks to take on early distributions without having that additional tax on that distribution, which makes it easier for folks to access, which is great, right, for those folks that need it. But if we're really thinking about the long run, if we're really thinking about securing retirement, having that easy access is probably not the best thing. And if we move over to the next slide, we'll just briefly talk about the different policy implications of the CARES Act policy. The number one, like I mentioned, that elimination of the 10% early withdrawal penalty. For folks that need it, sure, that's great. I'm sure that there's a lot of people that are losing their jobs, that this is the first place that they're going to tap into money because, they're not making any additional money. They're also, for folks, especially folks that are part of the essential workforce that are being forced back into opening for business, a lot of these folks don't have the proper PPE. So if they were taking unemployment before and they're refusing to go back because they're scared that they're going to contract this virus, they're going to be also not getting those unemployment benefits anymore, which makes it even easier to access the retirement funds because they don't have other income coming, right? Additionally, the increase in retirement plan loan amounts, I mean, that's great that people can have access to that money, but again, it's a lot of money that, right now, if you take that money out anyway, you're still taking that money out of less than you've invested into that account. And additionally, I'm excited to see that that there's that way for required minimum distributions. This will definitely help some of those older folks that are deciding to take that pause, make sure that they can leave that money in there, take advantage of that, hopefully the market going back up. So that's great for them as well. But there are going to be those long-term detriments if folks don't pay those loans back, if folks don't, put that money back when the market gets better, or if the market does get better later on. And in the next slide, I also want to talk about, thank you, perfect, and just, really talking about the retirement prospects for folks in the different generational cohorts, especially when it comes to their declining 401ks. Like I mentioned, for current retirees, that high market loss is really going to prevent them from really being able to retire with dignity, because part of maybe losing some of that money means that they won't have access to their home caregiver anymore, or won't have the amount of money to be able to access the healthcare that they need, the medication that they need. So that is really a huge loss for these folks. For those folks that are nearing retirement, I mean, a big part, my mom is 50 years old. She just became a citizen. And so, having me as a daughter, I'm over there pushing her to try to make sure to put more money in her 401k. But she's gotten reduced hours at her job. And, our goal was to be able to put in some catch-up contributions, but that's actually no longer even a choice. And it's no longer a choice for a lot of these folks that might be in that situation that did want to catch up, with their retirement contributions. And for the Gen X community, right now, during their 40s and early 50s, this is the peak earning years for a lot of these folks. And so losing that time is going to be very detrimental, and losing those incomes, especially because we're probably not going to be seeing a lot of folks get raises within the next couple of years. And let alone, we've also seen folks that have had to take pay cuts to even keep their jobs. For millennials, this is not looking great for all of us, right? So we, like Shai and Tyler mentioned, we saw the Great Recession. We graduated into a really, really bad market. And now that a lot of our folks were going into their careers, were finally, filling in their stride and finally, being able to get paid a little bit more, getting access to retirement plans because they finally, achieved 2 or 3 years into their workplace, which allowed them to finally be vested into the retirement plans. More than likely, these folks are losing their jobs, and they're going to be depleting those savings, specifically their retirement savings, because, like I mentioned, even though these are supposed to be savings for, the long haul, it's usually the only thing that folks have. And especially for communities of color, it's not like this money is a lot of money. For communities of color, most have less than $10,000 into those accounts. So that's really the what's going to be the defining moment, whether they're going to go homeless, whether they're not going to have enough money to eat. It's going to be that retirement account. And for Gen Z, I mean, are they even going to be able to find jobs? There's a lot of folks that are graduating from college, but those folks that are also graduating from high school who may have never had the, may have not thought about going to college and thought about going directly into the workforce. I mean, there's already that workforce there that already has the training. Those jobs are going to go to them and not to the high school 17-year-old that's looking for that job.
So one of the things that your presentation is really highlighting is we're very focused when talking about losses and retirement accounts and stock market losses. When we're doing that, we're always talking about someone who had something to lose. Yeah. And you're focusing, as you go through these cohorts, you're really focusing increasingly on individuals who are either too young to have started to put together a significant nest egg, or who haven't had the opportunities either because of educational attainment, because of the communities they live in, for a whole host of reasons, have not really had access to begin putting together a nest egg. So they can't lose what they don't have. That doesn't mean that they don't have that they're not losing something else. And so, I do think a lot about, during these last few weeks and months, how just even the idea of what retirement will look like, not in the ways that we often talk about, will folks will folks be healthier and live longer? And will that mean that they will want to work in different fulfilling occupations, whether they be volunteer work or paid work? Whether or not all of this is really transforming those questions, because younger cohorts and particular communities are just, they're not going to be able to afford to ask those exciting questions, and are going to have to ask more basic questions like, how am I going to make ends meet, or how am I going to live? And I know that you have one last slide before we close out and take questions from folks who are listening in today. Maybe you could just get to that one really quickly. And by the way, congratulations to your mother. That's a very exciting news to share with everyone.
Thank you. Sure. And, as we're talking about just how detrimental, the outlooks are during COVID-19, I also wanted to make sure that I also included some policy solutions, because there are things that, through legislation we can pass to make sure that our communities are also protected as they start thinking about retirement, and as we can all take care of each other, because at the end of the day, we're all in this together. Yes, we're experiencing COVID differently, but we can all have support through these policy solutions. First and foremost, Social Security expansion. One of the ways that we can make sure that we can have that Social Security becomes solvent, including more communities. And a part of this, that one of the things that I always advocate for, is a pathway to legalization for undocumented communities. There is a labor force of 11 million people that is working, that's ready to work, or that is, ready to really be a full part of the American customs, culture, et cetera. They're already in it. And that means that these folks would no longer be exploited. That means that these folks would be getting paid a living wage. And at the end of the day, even if we don't reform Social Security, you would still have a group of folks that would be paying more money into Social Security to be able to make that solvent. So I think that's another big part of the solutions for me. But also having a caregiver credit for and paid family leave. A big part of the reason why communities of color and just women in general aren't able to retire with dignity is because they're taking time off to take care of their kids. They're taking time off to take care of their grandparents. They're losing income. They're losing Social Security credits. And to make sure that those women do have dignity in retirement, even to say that they are going to get a full Social Security benefit, that's definitely a big part of having this conversation and being able to create that caregiver credit. And lastly, accessible and affordable healthcare. We still don't even know how how COVID-19 is going to affect the wealth of families in the long run, and let alone their health in the long run, because a lot of people are seeing that they're continuing to have different effects even after they've been cured, or the disease has passed through their body. They're still getting sick. They still have ailments. So that's going to be a big part of the reconstruction, I would say, of the United States as we move forward within these policy changes for healthcare. And additionally, like Tyler mentioned, state-sponsored retirement plans are going to be a huge part of this conversation too, because I feel like the only way that we're really going to be able to ensure that people do have money at the end of their lifetimes is really forcing people to save, and especially for those folks that don't have access through their employer, they would be able to access these through the state plan. So obviously very broad solutions, but I think that they are a start, or at least to think boldly about what we could be doing for all Americans.
Thanks, Abby. And that last point is a great segue to the first question that we want to pose to the panel. There's a question that's come in. If any of you are estimating if there's going to be a significant shift in the percentage of jobs that are public sector jobs versus private sector jobs. You made the point, Tyler, that maybe as we move into the future, we'll see more DB plans because of public sector jobs are going to be needed to rebuild certain parts of the economy. And also the question's really coming from the viewpoint that a lot of private sector jobs are going to go away. They're not going to come back. So to the three of you, who would like to tackle that one?
I can certainly start. I mean, I think at the moment, that's one of the bigger policy questions that lawmakers in Congress and in state houses are facing And it really gets to this debate the Congress is having right now about providing aid to state and local governments.
Mm-hmm.
I think given collapsing state tax revenues, a lot of state and local governments are going to be under pressure to cut jobs in the next couple of years. And that obviously would be detrimental to having more people in public sector jobs and participating in public sector pension plans. I think there could be, I mean, I can envision a scenario in which the Congress does act to provide aid to state and local governments so they can at least maintain their current workforces. And then I think the question is, as we start to rebuild out of this, do we invest, for example, in a public health workforce, where we hire a lot of people to do that work, whether it's contact tracing or it eventually grows into something beyond just contact tracing to respond to COVID-19. But I think in the near term, there is a very real question about a loss of public sector jobs in state and local governments. And from the public pension perspective, that would be challenging.
Yeah, I want to just add to that a little bit as well, is that, part of that aid should also be going into the education space and for public school teachers and just the public education system in general. You can't restart the economy without restarting schools. Where are parents going to, put their children if it's not going to be through the education system? So I think that also has to be a big part of what we're asking our legislators to do.
We have a follow-up question also for Tyler or any of the three of you. If there's been a breakout, that slide that you showed, Tyler, with the disparity in the 2% versus 98% of the assets and who owns them. I'm sorry, I got that wrong, but you know the slide I'm talking about. If you've broken that out by race, and if is that something that you can make available?
In that issue brief where we looked at financial asset inequality by generation, we did not break it down by race. We only broke it down by generational cohort. We didn't break it down by race or gender or any other measure. We are considering updating that issue brief once we have data from the 2019 SCF. And again, we would do that by generational cohort, but we could definitely look at potentially including breakdowns by race and gender that time. But I mean, that probably wouldn't come out till sometime next year if we did that.
Okay, well, I'm sure everyone is going to look forward to getting that from you in a bit of time. We have two questions that are related to each other, so I'm going to try and marry them up. We've had a couple of questions about whether the seriousness of this crisis and the impact it will have on so many age cohorts, the retirement security of so many age cohorts, will this finally be the thing that pushes Congress to take action? Second version of that question, is this what will finally make voters maybe look at these issues as ones that they're going to vote on? Will presidential candidates pay more attention to these issues? So these are all kind of related questions of, will this moment create the political will to address some of these long-standing issues?
I'll jump in quickly. I hope so. But I think we've been saying that for a while when it comes to, not only Social Security, but retirement security in general, that there's been a lot of people who just don't have enough savings to live on in retirement. I think it's unlikely that is going to be the first item on the agenda for the next, 12 to 18 months as we try to get relief from the worst of this crisis and then start the recovery. But I think afterwards, just the fact that so many people are going to be in so much worse of a position than they were even before the crisis, at which point many of them were already in an unhealthy financial position. I think that's going to demand the attention of policymakers. I'll just note, in my comments earlier, I actually misspoke. The estimate that we have in terms of the trust fund, what it would be able to pay out at that point of exhaustion, is actually only 69%. I was confusing that. The 76% is the OASI number in the latest trustees report. So it is actually the larger than I recalled gap if we had a downturn along the lines of the Great Recession. So anyway, I think that date coming closer and that number being so large in terms of the cut that it would generate, which is obviously unsustainable for so many Social Security beneficiaries, I think will mean that action is necessary.
And I'd like to add to your question, Cristina, that for our organization, we've actually seen a huge increase of participation from the Latino community, where before this crisis, I mean, people really didn't pay attention, unfortunately. So it's been almost a blessing in disguise for us, at least to know that the community is finally not feeling impacted, because they've always felt the impacts of income inequality, not having access to retirement accounts, et cetera. But I think they're finally seeing themselves as policy stakeholders, especially at a time where, CARES Act legislation left out a lot of Latino communities, especially Latino communities that were part of mixed status families. So I do think that there is going to be a huge momentum to hopefully inspire our legislators to do something for all of our communities.
And you're referring, I think in particular, you're referring to the stimulus payment and the treatment of different individuals based on status. So appreciate you bringing that up. We have another question also really about political will, or maybe I'm getting the question wrong. Maybe it's really about efficacy of a policy to have long-term care as social insurance. And the crux of the question really is about how expensive long-term care is, and how difficult physically it is to be in the position to need long-term care. So you've got that problem, and how much it drains the retirement income of not only the person who needs it, but also family members. So a lot of different threads there. Is this moment really creating an appetite to create long-term care social insurance? And to the three of you, what do you think of that?
Yeah, I'll say that I hope so. Actually, the next report that NERS is going to release is going to start to look at the issue of the cost of long-term care and the cost of health care and the cost of housing in retirement. And long-term care is a very difficult issue to manage. A lot of people don't need it, but if you do, it's very expensive, but it's hard to know if you're going to be one of the people who's going to need it. So I think, looking at what Washington State's doing, where they're trying to create a social insurance model to provide long-term care, I think that's a good starting point. I think in general, this current crisis has sort of ripped the Band-Aid off and exposed a lot of the inequalities that we knew were already there. And so I hope this spurs people on to continue to act. Going back to the previous question, I think it's encouraging that Congress had passed the Secure Act at the end of last year. I don't know if it would be considered a major piece of retirement legislation, but it was a piece of retirement legislation that Congress passed. And I think it's good that they were already showing a willingness to act. And I hope that our current crisis inspires them to act even more and more aggressively.
Well, thank you, Tyler. You're going to get the last word since we're at 2:59. So throwing it back to our wonderful hosts, and thank you all three of you have been wonderful. Back to you.
Thank you, Cristina, for moderating, Abigail, Shai, and Tyler for sharing your insights, a very provocative and timely discussion. Thank you for all of our participants for the contributing to the discussion with solid questions. And you'll be getting an email following this webinar with a link to a brief survey. We appreciate your feedback. We rely on it to modify future sessions. We'll also continue to provide opportunities for all of you to exchange ideas through virtual forums such as these. Our next roundtable will be on Tuesday, June 2nd. Relevant, Abigail, to your comment, it'll be focusing on healthcare issues caused by the pandemic, including over the long term. So you'll be getting more information, all of you, by email. Also, our website, as I mentioned earlier, we continue to update with new resources. Among them, relevant, Shai, to your presentation, on a Saturday, our monthly, this month at the Academy, has a piece on the impact of COVID on Social Security's finances, taking a look at a broad set of questions, but not diving into the details that you did, Shai, more of a framework to try to anticipate the challenges. And then Tyler mentioning long-term service and supports. We'll be launching a series of webinars in the summer that focus on caregiving in general and long-term service and supports in particular from a state-by-state perspective, building on the Academy's study panel on designing universal family care. We also will be issuing an issue brief looking at the German social insurance model for long-term care and what its implications might be for the United States. For all of you Academy members who are still with us on this virtual roundtable, thank you for paying your dues. If you haven't, please do so today. Our work really depends on your support, both through donations and through dues. Finally, we're still in the midst of great uncertainty in the coming weeks and months, so please keep all who have faced losses in our thoughts, and all of you stay well. Thank you again, and we'll see you again in 2 weeks. Bye-bye.